So what I'm going to do first is I'm going to make sure I have my orders correct. I have the right name, the right age, the right gender of this patient I'm going to go into and see. His name is Mr. Bob, and before entering his room, I'm going to make sure that he has no notification saying that he has isolation precautions or fall risk. So after that, I would then knock on the door, knock. Mr. Bob would say hello. I would then ask him if I can come in. He would then say yes. As I'm walking in, I would be scanning the ground, doing my 60-second assessment, and seeing if there's anything on the ground, like any sharps. Come in here, seeing if there's any sharps or any liquid on the ground, any sorts of things that could potentially be tripping hazards for him. And after that, I would then check to make sure all the equipment was working. I would then make sure that he has his call line, make sure everything was working. I would then provide privacy by pulling the draw. I would then, before I entered the room, I would have washed my hands already. I then introduce myself to the patient. Hello, Mr. Bob. My name is Steven. I'm your nursing student today. Is it okay if I can get your name and your birthday? Sure thing. So I would check, and he would tell me my name is Mr. Bob, and his birthday is the 4th of April of '92. I say, excellent, that's who you are. I would then talk about the procedure I'm going to do. I'm just going to do a head to toe. And while I'm talking with him, I'm gaining a level of consciousness. As I walked in, he saw me and he was aware of me. He's answering my questions, so I know that he has a good level of consciousness. I then say, I'm going to have to ask you a few silly questions, just to get his ANO. I'd ask him, where are you? He'd then tell me the hospital. I would tell him, what's today's date? He would give me today's date, and then I would say, and why are you here today, to get the situation of why he's here. So after he's giving me all the appropriate information, I then make sure that his rails are up and his bed would be lifted to a normal height. So. And I'm going to put him in semi-Fowlers, just so I can do I hit the toe a little more easier for me.
Yeah. Just be like Matt's fat as fuck. It's hard to get placed.
Move the rail out of the way. Before touching him, I would make sure I put my gloves on.
I'm just saying what she's gonna say. I guarantee you.
All right. I'd ask him how he's feeling. I would notice his mood, his speech, and seeing if he's having any sort of issue with talking, like there's some underlying pain. If he had any underlying pain, I would ask him, is there anything, I would be curious about his pain and ask him if he is experiencing any. And if he said yes, I would ask him what makes it feel better or worse. I then ask him the quality of pain. Is it stabbing? Is it throbbing? Is it piercing? I then ask him which region it is in, and from that region, does it radiate to another part of the body? After that, I would ask him the severity of it. Is it on a scale of 1 to 10? 1 being the least and 10 being the most painful experience you ever had, where we would fall in. And then timing, I would ask him about when did this pain start to occur, how long is it going for, and when you do experience the pain, how long does it last for? After gathering that, I would then start my head to toe after telling him that I was going to. I would then check the hair, just seeing the color, noting if it's greasy or if it has a foul odor, seeing if it's gray or brown, seeing if it's falling out. Normal findings would just be regular hair that has regular hygiene maintenance. I would check the scalp, see if there's any moles, any cuts, any bleeding, any deformities, any abrasions, lesions. I would then check the back of the skull, the occiput, and see if there's any pressure ulcers developing from being in bed for so long. I would then come down and check the ears. I would use my instrument to look inside his ears to see if there's any excess cerumen being built up, because that can impair his hearing. I would ask Mr. Bob himself if if he had impaired hearing because of the possible buildup in his ear canals, and he would tell me no, he can hear just fine. Awesome. I'd also know if there's any bleeding, any synovial fluid in case he's had some head injury. We don't want to have any of that leaking out. A normal ear is just pink or just skin color, and I'd also check around the back of his ears to see if there's any pressure ulcers from the nasal cannula that's building up on it. I then go and check his nasal area, checking the inside the nostrils, and checking to see if the septum is intact, to see if there's any blood, any synovial fluid in case he's had some head trauma. I would just palpate to make sure that the bridge is intact, and just check to make sure that everything wasn't broken. Check the zygomatic process, the cheekbones. I then come and check the eyeballs. And the normal range for pupils is 3 to 5 millimeters. I would come outside to in to check if there's the pearl, where pupils are equal, round, reflective to light, and accommodation. I can't do accommodation because I don't have the special instruments to do so, so I would have somebody refer him to a optometrist. So I check the one eye, all right, it's reactive to light. Now check the other eye, also reactive to light. So the eyes are both reactive to light, and I use my pen to see the size of the pupil. All right, it's in normal range. I would then take my pen. I would say if you can focus on my pen, and this is just to track to see if his cranial, his ocular nerves and muscles are working correctly. So they should follow the pen, being able to go focus out, focus in, to make sure that his muscles are not damaged in any way. I would then start going to the mouth region, checking the lips, seeing if there's any cold sores, if they're pale blue, they're chapped from being dry. Normal is just pink, somewhat moist, as a normal finding, but there's no cold sores, nothing around the lips. So I can go into the mouth. Looking into the mouth, I would use my pen light and see the inside, checking the teeth, making sure that all the teeth are there, there's nothing missing, checking for cavities. I would check the tongue, make sure it's pink, not so there's no fungal infection like thrush. Making sure that it's also pink and not cut or break or damaged in any way. I would check the gum lines, making sure that they're also pink and regular and they're not receding from the teeth. I would check the buccal area, making sure they're also pink and there's nothing irregular about them. There's no food pockets in the side of his cheeks so that we don't accidentally aspirate. Checking both sides. I check the palate at the top of the mouth, and then I'd also check the tonsils in the back of the mouth just to see if there's any red, any inflammation, any of the abnormal signs. And then from the mouth, I would then just palpate, make sure that the jaw is intact. I would have him push against my hand to make sure that he has normal range of his jaw. After that, I would then start to go down to his neck. I would palpate for the lymph nodes and see if there's anything abnormal. I shouldn't be able to palpate any lymph nodes. Making sure that the trachea is midline. If the trachea is deviated, that means there's some underlying issue in the chest cavity. Also making sure there's no jugular vein distension. Again, that would indicate there's something else going on in his body for those to be distended. I would also, in the neck region, check for any step-offs in the spinal cord, making sure there's no pressure ulcers happening underneath. And for the neck, I would make sure that none of the axillary muscles are being shown from having to breathe extra hard. Then after doing the physical examination, I would then auscultate and check the trachea for bronchial sounds, making sure there's no wheezing or stridor, making sure there's nothing blocking the airway. It's clear and normal, so that's what it should be. A clear airway should be patent. And then after that, should be the head.